Justin Ott, physical therapist and owner of Ott Physical Therapy. I'm joined today with a very special guest, Cara Troutman-Enseki. Met her a long time ago when I was still in Pittsburgh. Cara, can you introduce yourself to the audience?
Hi, yeah, I'm Cara Troutman-Enseki. I graduated from Pitt's Physical Therapy School 17 years ago, not to date myself, but 17 years ago. I worked at the Rooney Center in Southside Pittsburgh for the past 17 years. I started out just treating general ortho, so knees, hips, spine, everything. Um, Probably about 10 years into my career, I started leaning more towards concussion and I started treating for exertion therapy. So after concussion, you have vestibular therapy and exertion therapy. So my role was to kind of take them through workouts, and then I became the coordinator of exertion therapy. While doing that role, I met a pro athlete, and with that, I actually left my job a little bit to work one-on-one with that pro athlete because he wanted tailored workouts, physical therapy whenever he wanted. After that ended, I did go back to sports. When I went back to sports med, I gave up my role as the concussion coordinator, but then there was a spot open for youth athlete program coordinator, and that's more my role now. So now I'm more in that role, treating youth athletes and working on injury prevention with them.
I still remember being back in the day where I was a rehab aide before I even got into school and working alongside you in the clinic. And it was probably one of my favorite times and favorite PTs to be working with. It taught me so much about the intuitiveness, the creativeness that we can be as PTs. Some of your exercises, like just how much more difficult we can make it by adding different components to really be tailored to the different specific needs of the patients, always stood out to me. So I definitely got a huge interest after working with you with vestibular and concussion. It's been some of my personal favorite and little side niche of what I've been doing, one of my specialties over the years. So you definitely taught me a lot, and I can vouch that you are an outstanding therapist, and you know a lot of things about concussion and just sports in general. So the big thing is discussing about how we can always match the abilities of our patients, the athletes, and a whole range of it. So working whether it was athletes in the high school, collegiate, or professional levels, you always were able to do a certain kind of a molding of routines specific to the patient, which is always impressive. So, but now that you're doing a lot with the youth program here with all the athletes in Pittsburgh, can you tell me more about the youth sports program that you're a part of now?
Yeah, so youth sports has exploded. We all know that everyone's playing younger, playing year round. There's this need to kind of have these medical professionals that help not only rehab injury but prevent injury. So our youth program uses a multidisciplinary approach. So we have our ortho MDs, we have our primary care sports medicine doctors, we have physical therapists, we have sports performance nutritionalists, sports psychologists, neuropsychs, and concussion. We all work together to kind of tailor programs for the athletes, not only when they're injured, but when they're not injured as well, to kind of prevent those injuries from happening.
That's an incredible setup you have there. I got to say, at the time in Pittsburgh, I took it for granted that everything was in-house and you had some of the best people in the best fields working together and really gave a true multidisciplinary approach that was outstanding. And I wish I had that growing up because I remember when I was playing soccer, baseball, or skateboarding, I fractured my elbow playing soccer. I had knee surgery at one point and I broke an ankle from skateboarding. And I always thought it was an advantage, and I was very lucky to have a mom that's a physical therapist that kind of helped me through some of that. So, what are some of the more common injuries you have been seeing in youth sports, and do any of these seem to surprise you?
Honestly, we're still seeing everything that you would expect to see. ACLs. ACLs are huge still, and I'm actually seeing them younger, unfortunately. I've seen 10-year-olds with ACL tears. And obviously the surgical procedure is a little bit different because their growth plates are still open, so rehab's a little bit different for them. But we're seeing the typical overuse injuries too, your tendonitis, your patellofemoral pain types things, everything that you see in your older athletes as well, but we're just seeing it younger and younger. I think the youngest person I've had in the clinic is 8. So we are seeing young kids.
I gotta say, in my experience too, overuse injuries has been a big thing that I've seen with athletes, especially younger. A lot of times I think that there's a lot of parents that really push their kids, whether it's, hey, they want to be the best at their baseball team, they want to get a scholarship, they want to go through it, and they're playing on 2 or 3 different teams. They're limited, even in the professionals, you limit how many pitches are going to be thrown because you don't want to risk that overuse or injury. I think that sometimes gets lost on parents because they see the potential in their kids and they push them. without knowing kind of the certain things that they're putting them predisposed to being exposed to. So do you see many injuries in your youth sports program that are caused by overuse activities and training? And if so, what types of sports and injuries do you see in?
Of course, we see overuse injuries. I mean, your baseball players, you're going to see elbow injuries because the rotator cuff isn't strong. Your dancers, you're going to see hip injuries. You're going to see Achilles tendonitis in your ballet dancers. Gymnasts, you're going to see knee injuries, just like your patellofemoral pain and the tendonitis in there. I mean, every sport has an overuse injury. And I've changed my view a little bit as since I've been a mom with a youth athlete. So in my early career, I would give the advice, don't play a sport year round, but I would be a hypocrite, and I'm going to be honest, that's kind of not possible in a lot of sports nowadays. So for instance, my daughter's a dancer. My role has changed now to make sure she's as strong as possible to prevent injuries. She gets breaks, but not as much as I would ideally like. So she's strength training. She's strength training at least 3 times a week during like that heavy season of comp season. She's strength training at least twice a week to maintain her strength. And like I said, I would be a big hypocrite if I said you should take time off, don't play the same sport. It is so impossible now, and I see the struggle of parents because there's indoor baseball, outdoor baseball, baseball's year round, indoor soccer, everything's year round, and it's so hard. And it really is this keeping up with the Joneses because you have little Jimmy playing baseball, getting special catching and pitching lessons, and then your kid's not doing any of that, and you really are behind. It's crazy. It's a crazy world right now, but the shift is more make sure you prevent these injuries and keep your kids strong, because that's a big hole. We didn't have that growing up. We didn't have strength training. We just did our sports, and we were lucky. We were lucky because we did play multiple sports and we didn't play year round, but it has changed so dramatically. And I think as physical therapists, we have to kind of recognize that and help people educate them on how to kind of overcome that.
That's it. I've incorporated that a lot too with the different cross training where don't necessarily do one specific thing, but do other exercises, strengthen it to prevent you from overdoing it when you do those things. So couldn't agree more with you on that with what
Yeah.
I'm seeing.
Yeah, Vivi, like my daughter does not strength train in dancing positions. It's everything other, like she doesn't do things in turnout. It's everything else to prevent those weaknesses because she's strong in all the dance stuff. Soccer players are strong in all their soccer stuff. They actually need to do real strengthening.
Say that applies not even to athletes, but whenever I think about why are we doing this exercise to carry over so we can be stronger, so we can do the things we're struggling with, whether it's in geriatrics trying to just get to a sit to stand up correctly, use the right muscles. So definitely important. Another thing I want to touch base on is when I think about sports and growing up, and I think you're in the same era as me, where it was always you're out in the fields, you're outside, you're getting that fresh air, you run around, you're coming in sweaty and smelling, and then you come in for dinner. Something I've seen, I definitely see it. I have a nephew that is on his tablet or working on video games, and I've seen a bigger uptick in the e-sports. So it's got sports written right in it, but it's not something that I would naturally have thought about as an athletic thing where you're putting yourself at risk for injury. But I have been seeing a lot more kids that are coming in. And it almost is presenting like a person that's been working in the field doing desk work for a while because they're sitting there static positions, and that's got a toll on the body too. So have you experienced any increase in younger patients with similar findings? And what are your concerns if you are?
Yeah, not just younger, older too. It's now collegiate sport as well. Point Park has an esports team. We actually had several meetings on this stuff because there's your postural injuries. They're forward, their chest is getting tighter, their back's getting stretched out because they have the rounded shoulders. So then the rotator cuff, scapular musculature, everything's getting weaker back there. We're seeing elbow injuries, hand and wrist injuries from the overuse. So again, it's just like any other sport, educating them, make sure you're doing stretching exercises for your wrist, your elbows, strengthening. I mean, some of those video games, they actually mimic motion, so you might need to strengthen your rotator cuff, and then just making sure when you're in those sustained postures, you're taking breaks every now and then. But this was actually a big meeting in our company because of the becoming a collegiate sport as well. But it's not just the sports, it's kids just sit on their tablets all day.
Yeah, I agree. I agree. Yeah. Kind of getting back to more of the things that I think that I can be better in tune with, whether it was soccer or anything. One thing that stood out for me from one of my injuries was I kept spraining my ankles when I was younger. I would skateboard, I would play soccer, I would roll that ankle, and it'd be one of those, it's fine, I'll walk it off, and never really did true rehab with it, which I think is just something that I didn't take my mom seriously on, which was saying you really should do your homework, but just like vegetables, I wasn't always taking it in. But that was one thing that for me, and I think that I see it a lot too, is the weakness in ankles, especially when people aren't being as active. If they're on the tablets, they're simply not on their feet as much. And I think that I've incorporated a lot of balance and strengthening programs into that too when I'm working with people. So now as a PT, I understand chronic ankle instability, and I wish I'd known what I know now. But you know what they say, hindsight's always 2020. But do you mind explaining what chronic ankle instability is and some of your favorite treatment approaches when helping a patient go back to higher level activities in sports when it comes to balance training?
Yeah, fun fact, I was soccer and I have chronic ankle instability too, so we're like the same.
Not alone.
That's right. So chronic ankle instability is when you kind of injure the ligaments and tendons in your ankle from repetitive spraining. Soccer is a perfect example because when you're running, you're kicking, you have the tendency to roll that ankle several times. And if you don't properly rehab it, you can have two types of instability. One could be mechanical, where the tendons and ligaments don't actually heal themselves, so they remain on that stretch and you're not as strong. And the other is functional. So you didn't really gain your strength back and your proprioception is off. Rehab wise, I really, really, really focus on strengthening. So inversion, eversion, plantar flexion, dorsiflexion. I work a lot on soleus. I feel people miss soleus a lot. But then I work a lot on proprioception and balance, and not just like a single leg stance. I do a lot of dynamic stuff. I do what's called a tree matrix, but all it is a variation of the Y balance where they have to go in different directions to kind of challenge them. Eyes open, eyes closed. When they get good at that, I'll introduce running. And then after that, agility, plyometrics, cutting, and then return to sports.
And I absolutely love incorporating all those exercises, whether it's an athlete with an ankle injury or even with your history. You know exactly what I'm going to get at, the concussions, the
Yeah.
vestibular components, and it makes such an impact. And I think people don't realize how you close your eyes and it's a whole different world when you can't see and how much that makes an impact. You get some head movement in there. There's so many ways as therapists, I think that we can be unique and really kind of modify things to be specific to weaknesses of the people. And it gets fun. I got to say, it's definitely one of those things. I've never had someone fall yet, and I don't want that to
Oh,
happen.
knock on wood.
Yeah, you never say those things out loud, but it's one of those things. It's fun because you know that you're challenging people and how that carries over to their day to day to be a little bit more preventative. And I think I still remember you teaching me cheerleading moves, and I
Yeah.
would be more hesitant to attempt a perky today without warming up first. So there's balance, but also things were just going out. Right, I don't bounce back nearly as quickly as I used to. So. One thing I would like to touch base on is, do you have any advice for athletes on ways to perform general warm-ups before getting into a game or practice that might help to reduce the risk for injuries?
Yeah, make sure you do a dynamic warm up. I don't really do static warm ups, and then pick an activity for your dynamic warm up that mimics what you're going to do. So, for instance, if you're going to go play baseball, do some rotator cuff and exercises, maybe like ball on wall, get the arm going a little bit. But if you're going to go play soccer, high knees, butt kicks, lunges, med ball twists, something to kind of activate the muscles that you're actually going to be using to warm them up.
Yeah, I remember I did an impromptu little race without warming up or anything. Pulled my hamstring, and it
Yeah.
was a reminder of you got to take care of your body, or it'll let you know.
We're
And
not
then
taught anymore.
yeah, right. And then unfortunately, sports related injuries still occur even with preparation and training. But from an acute on the curve perspective, what would your advice be for coaches and parents when seeing a player get injured in real time?
Yeah, if you see someone get injured, get them off the field, shut them down immediately because you're just letting them risk getting further injured. And then if they're the next day they're still feeling awful, like if they have an ankle sprain or something, get them to see a health professional. It doesn't have to be a doctor, it could be a physical therapist with direct access, but I would see a medical professional if it's still lingering. But immediately get them out of play, shut them down if they obviously if they can't walk or if they're swelling or if they have a concussion. That's your best bet to prevent further injury.
I agree with you. I feel like, and I know for me, it's oh no, I'm tough. I can get back in there. I don't want to come off the field. And I see that a lot with kids that they don't necessarily know better, but be as adults and the onlookers and ones that have to protect them too. I think it's very important to do exactly that. And like I say, I always felt lucky because whenever I was in a soccer game or anything, my mom's on the sideline. She would give her 2 cents, so she wasn't bashful about it all. She would get in there and be like, "No, you got to do it because this is protecting the kid. Because the injuries could just get worse if you try to play through them too." And so
Absolutely.
I'm sure that your daughter has the same kind of benefit too, that you can see things from the sideline and be a little bit more proactive about that too. So as a mom watching a daughter challenge herself on increasingly more difficult activities, are there any areas that you feel like you would give you an advantage as a PT that you would try to encourage and educate your daughter in to help her to continue to excel at a high level?
Yeah, I mean the injury prevention is key. Like I alluded to before, we strength train. I mean, I have a deal. I said I'm not going to sign you up for these higher level activities and pay for it if you're not going to put in the work to protect your body. So, like I said, she's strength training 3 days a week off season, at least 2 days in season, and we're just warming up. Like every competition we go to for dance, she does an hour. She's intense, but she does an hour warm up before she even goes on the stage, and she has it down to a pack routine where she's doing like heel raises, balance stuff, everything that we've talked about, she's doing, and she is lucky that I know what to give her. But I've had other parents on the dance team reach out and ask me to help their kids too. So I've been giving strengthening exercises to her whole little group of dance friends, and it's helped them too. Knock on wood, we made it through the season without any injuries in her dance group. But I just think she does have the advantage because my husband and I are just so strict on, if you're gonna do this, you have to protect your body. You have to work out and stay strong. She is strong. She can deadlift 95 pounds at 10, so she's a strong little thing.
That's impressive. I don't know if I could do that at 10 years old. That's pretty good. That's incredible. So I guess kind of wrapping everything up, I would like to end with getting your take on what you think are some of the more valuable lessons you have learned when you sports. So what are some valuable insights beyond warm-ups that you have to help reduce or increase risk for injuries? I know you're saying about the strength prevention. Is there anything that you would just tell a parent that, hey, my kid's just getting into more competitive soccer? I remember the year where I went from just like a regular rec league, they signed up to travel soccer, and it was a
Mhm.
whole different level. And I know my parents, I showed up for my first tryout without shin guards because that's how unprepared we were.
Yeah.
So I think that just giving some insight to parents too to give them some confidence and, well, here's some things to kind of look out for your kids when they're getting into sports. I think the strength training, the balance is a huge part of it. Anything else that you think would be appropriate?
For myself, things that I've learned is not to be so narrow-minded. Like I said, I've changed my view on like what you learn in school versus what the real world is. So you have all these rules in schools, like you should shut down for like a summer, you should play multi-sports, but you just, I can't be as narrow-minded because I know that's not realistic for people. So just listening to the parents, listening to what they want for their kid, listening to the kid. Like that's another thing. Sometimes it's the parent that wants all this and the kid doesn't even want to play the sport anymore. So it's really listening to the kid, giving the parents the tools, like we talked about, strength training, balance, just making sure like there are no weaknesses to prevent injury. Obviously, we're not going to prevent everything. Like you're not going to prevent that non-contact ACL tear. If it happens, it happens, but like giving them the tools of what to do after that as well. So if it does happen, it's not the end of the world. You can rehab it. It's going to take this long, and giving them realistic expectations.